Dr. Drucker, the World Health Organization is conditionally recommending GLP-1 drugs to treat obesity. Of course, they were originally developed to treat type 2 diabetes. So how significant is this announcement?
I think it's very important. We've had a great deal of difficulty in many communities with recognizing obesity as a serious disease, with obtaining reimbursement for these GLP-1 medicines. So the fact that the WHO has looked at the totality of the data and come down on the side of these medicines being important to improve human health for people living with obesity, I think it's a big step forward.
Well, it's estimated now roughly 1 million Canadians are taking drugs like Ozempic for weight loss and diabetes. How effective are they for treating obesity? How much weight are people losing?
You know, we started with liraglutide 11 years ago. People lost 5 to 10% of their body weight. Semaglutide up that 10 to 15% of their body weight. More recently, tirzepatide, we're seeing 15 to 20% of their body weight. And most importantly, you know, in people with serious heart disease, we're seeing reduced heart attacks, strokes, reduced rates of death. So we really can improve health with these medicines.
As you know, social media is filled with celebrities and others, some touting success stories and how it's helped their health, but also a lot of young women talking about how these drugs are helping them drop the pounds. Are you at all concerned that it's adding to an unhealthy pressure to be thin?
This is definitely an issue, and we do worry about young people and body image and social pressure. I think there's a need for use of these medicines to be made in conjunction with an experienced healthcare professional who can always assess the risks and benefits and be a partner along this weight loss journey when it's appropriate.
And so when you see people speaking out about it on social media, how confident are you that they're actually having an informed conversation with their doctor?
I think it's quite variable. As we know, in many countries, you can arrange an interview on the internet and have someone fax you a prescription, and it may not be difficult to get these medicines. So I don't think we always have people using these medicines under the optimal circumstances, and there's more work to do in that regard.
We're also hearing on social media people who are concerned about the side effects of using Ozempic for weight loss, like this.
The one side effect I was warned about on Ozempic was that if I overate, I would projectile vomit. That's never happened. But here's what's actually happened. There are 5 side effects I've experienced while being on these medications. That is nausea, fatigue, diarrhea, that's always a fun one, migraines, and constipation.
A study by the New England Journal of Medicine have found that 40% of weight loss that you experience from taking Ozempic will come from muscle loss. And weight loss through muscle loss is the unhealthiest way to lose weight.
So those are some pretty nasty side effects, projectile vomiting. We also heard about muscle loss. How dangerous is muscle loss, and what effect does it have on the immune system?
So when we lose weight, whether it's diet, exercise, bariatric surgery, God forbid, a serious illness, we always lose a proportion of lean mass as well as fat mass. The reality is when we do surveys of people in these weight loss studies over the long term, and we ask them, how strong are you? How energetic are you? Can you do more? Can you exercise more? People actually feel healthier and stronger on these medicines. Now, is there a possibility that someone who's older and more frail might develop some weakness? Of course, but the vast majority of patients find that their health is improved rather than deteriorated after weight loss with these medicines.
It's interesting, and I'm curious about the long-term effects. We know that people have to stay on these drugs long-term because stopping them often leads to regaining weight. Do we know enough about what possible risks or side effects there could be from taking these drugs essentially forever?
So we never know everything, right? So, forever is a long time. These medicines were first approved for type 2 diabetes in 2005. So these are not new medicines. One can argue, however, that semaglutide has been around for, less than 10 years for obesity. Tirzepatide has been around for only 3 years or so. So there's always more to learn, but we have used these medicines in probably hundreds of millions of people with type 2 diabetes, most of whom are also living with obesity. So we'll always be vigilant about what we don't know, but these are not new medicines with an unproven safety record.
As part of its announcement, the World Health Organization also stressed that access to these drugs is still a major barrier. How concerned are you that as more people use them for weight loss, there will be shortages for those who might need them for diabetes?
I think this was a real problem perhaps 2, 3 years ago when semaglutide was in shortage, tirzepatide was in shortage, and it was somewhat unethical to divert those medicines from someone with type 2 diabetes and heart disease to someone who wanted to lose 10, 15 pounds because they wanted to go to a wedding. But we've seen major improvements in supply from both Novo Nordisk and Eli Lilly. We have a new form of a tablet that might be approved from Eli Lilly next year, pending regulatory approval. And we actually have dozens of new medicines in this class in late stages of clinical development, plus generic manufacturers in many countries poised to introduce semaglutide at a more reasonable, affordable price. So I think we've made a lot of progress in broadening the supply chain, but price is still an issue. These medicines could always be made more affordable so that more people who need them can access them.
Well, it sounds like there is a lot more to watch on this front. Thanks for your time today.
Thank you.
Dr. Daniel Drucker is in Toronto.